Ever pondered the long-term effects of chronic infections? Or how about the link between chronic inflammation and the onset of cancers? If so, today's topic might just spark your interest. We're diving deep into a groundbreaking study published in the World Journal of Gastroenterology. The study is titled Anti-Helicobacter pylori Therapy followed by Celecoxib on progression of gastric precancerous lesions. Quite a mouthful, isn't it? Don't worry, we'll break it down. In many chronic infections, there's an overexpression of something known as COX2. This leads to chronic inflammation, and over time can even lead to the development of cancers. Now, this study takes a closer look at Helicobacter pylori, a bacteria that can cause chronic inflammation in the stomach. This inflammation can lead to precancerous lesions, setting the stage for gastric cancer. So where does Celecoxib come into play? Celecoxib, also known as Celebrex, is a selective COX2 inhibitor. The researchers hypothesized that administering Celecoxib after eradicating the H. pylori bacteria could reduce the progression of these precancerous lesions. And guess what? They were right. The study found that Celecoxib resulted in a significant reduction of these precancerous lesions in the stomach. This is a big deal because it opens up a new potential pathway for preventing gastric cancer in individuals with a history of H. pylori infection. Now, imagine the possibilities if we could find a natural, safe COX2 blocker. That's where curcumin comes into the picture. Curcumin, a compound found in turmeric, is known for its anti-inflammatory properties and ability to inhibit COX2. Although curcumin wasn't part of this particular study, its potential role in this context is certainly worth exploring. But there's more. Overexpression of COX2 isn't only seen in bacterial infections like H. pylori. It's also observed in many viral infections. This means that the findings of this study could have broader implications beyond the realm of gastric precancerous lesions. So, to summarize, the study Anti-Helicobacter pylori Therapy followed by Celecoxib on progression of gastric precancerous lesions found that using Celecoxib after eradicating H. pylori significantly reduced the progression of precancerous lesions in the stomach. This finding could pave the way for new preventative strategies against gastric cancer and potentially other cancers linked to chronic inflammation. It's always fascinating to explore new research, especially when it could have a profound impact on our understanding and treatment of chronic infections and cancer. The future of medicine holds many exciting possibilities. One can only imagine what we'll uncover next. Until then, stay curious, stay informed, and most importantly, stay healthy.